All right, welcome back. This week I'm talking about semaglutide, aka semaglutide, and the effects it can have on weight loss based on a new study that I saw earlier this year in the New England Journal of Medicine. So, welcome back. My name is Reggie. I am the founder of Fit for Freelance, where I build adaptive business leaders through compassionate health coaching. I also am a freelance medical writer, and I work in public health policy. So this time I'm going to give you 10 things to consider with this new research that's coming out. It could be a game changer, as some places are calling it. I want to give you 10 things to consider and a way to think differently about your food and what it means to lose weight. So let's get into it right here. First of all, semaglutide, depending on who you ask, semaglutide, aka Ozempic, is a glucagon-like peptide 1 receptor agonist, a GLP-1 RA. And what that does, basically, it can act on your pancreas. It does act on your pancreas. And it also acts in your brain. So let me go to a slide I have on the effects of the drug here. So it helps make and release insulin. It slows your stomach emptying and it decreases your appetite. So that combination is going to come together to help you feel more satisfied. You're going to eat less, slower appetite, and then you're also going to release insulin. So it's used as a type 2 diabetes treatment. That's its primary use, and they're experimenting with it in higher doses for weight loss. And the potential side effects here, nausea, vomiting, diarrhea, and constipation. 74% of the people in the study had that effect, right? So that's something we want to keep an eye on. I'll come back to that a little bit later. And in the study, they did research on just about 2,000 adults without diabetes with a body mass index of 30 or greater, or a body mass index of 27 or greater with at least one weight-related comorbidity. All right, so that's the basis of the trial. And what they found was both study groups, so they did a placebo group and a group that was receiving the Ozempic, and they both groups were getting some kind of exercise lifestyle coaching, right? So that's what this slide's about. Both study groups received individual diet-related counseling sessions every 4 weeks, aimed at encouraging a 500 calorie deficit per day, paired with a goal of 150 minutes of physical activity per week. So, right, 150 minutes exercise per week, and just a light diet, 500 fewer calories per day. That's very modest. And what they found was that adults on the semaglutide treatment lost an average of 33.7 pounds by week 68. So it's a 68-week trial. That's about half pound a week. While those in the placebo lifestyle intervention only group saw a 5.7 pound weight loss over that same amount of time. So when you're looking at that, that's a staggering result. So I want to go over that and what it can mean to you and your health if you're thinking about it, if your doctor might be thinking about it, if you're catching up on your research, what it can mean for you, right? So what they want to do next, they want to continue the trial as an injectable. So the method of that was the weekly injectable for the semaglutide. I'm just going to say how I know how to say it, semaglutide. Weekly injection. So you're going in every week to get that injected. And then over time, you had those results. But the next step later this summer in 2021, they want to try with oral semaglutide treatments. And that one's known as Rybelsus. I'm not even sure how to pronounce that one either. Depends on who you ask, I bet. Which has some side effects if you're adding it in as a drug, right? So a lot of times when you're adding medications, you want to be careful with that. And these are some of the side effects and risk associated with the oral semaglutide. All right, so now I want to go over some things, how this can be really good for healthcare, public health, the weight loss industry, health coaches, and then some things that might be less favorable, right? So first up, doctor could prescribe medication for crucial chronic disease indicator, right? So obesity and overweight are important factors, and they're like intermediate steps in a disease process, right? So they are their own health risk, but they can also add up to more serious outcomes, right? So I have this slide here: premature death, type 2 diabetes, musculoskeletal disorders, also a lot of pressure on joints, right? Psychological effects, cardiovascular disease, heart attack and stroke, respiratory problems, certain cancers as well. Those are all associated with overweight and obesity. So if your doctor has an avenue to kind of mitigate that over time with the prescription, they might be really favoring that. Also, I want to add that I am a certified personal trainer and health coach. I am not your doctor or dietitian. So make sure you talk to your healthcare professional about what works for you, right? So the next thing, another potential positive, appetite reduction may be useful in food addiction treatment. So if you are having really challenging times cutting back on foods, certain foods, sugar addiction, food addiction, it's not like a DSM diagnosis, but it is an important factor. Using this to reduce your appetite could be very useful if that's what your doctor recommends, right? And so I have an example here like Chantix for tobacco, right? So if you have group support and coaching, sometimes still having a medication that can reduce your craving for that can help you start the path on changing your lifestyle. So that's a big benefit potentially as research develops. The next thing, decent way to start, but it's also dependent on use, right? So if you've been stuck for a very long time trying to lose weight, your doctor always tells you, all right, you could like lose 10 pounds, 15 pounds. Potentially semaglutide could be a good way to get started. However, this is where we kind of switch into some of the potential drawbacks is it's dependent on your use, right? So it's not like you're making any specific lifestyle changes just based on the drug. It's something that could be used to support your weight loss. So then I go into other things. One of the bigger things that some of my concerns here, not a solution for underlying health policy, food environment, or nutrition education, right? So a lot of the examples you can look at kind of how tobacco policy and things have changed over the last 30 years, and you can apply that to the same with food. So if people are constantly subjected to junk food advertisements, then they have more food urges for those less healthy foods, right? If people don't have access to fresh produce and other healthy foods in their area, then they're going to have a harder chance or a harder time making healthier choices based on their food environment. And that's at the macro level. If you look at the micro level, the foods that you keep in your house, it becomes intuitive, right? So if you have better choices available, you're better able to make healthier choices, right? And that's a health equity issue. It's a policy issue. A lot of times when we talk about weight loss, we talk about like individual choices, and I enjoy doing that sometimes, but as like a policy educator as well, we also had to think about the healthy environments. And I put Blue Zones Project, BZP, look that up. That's where people with the healthiest environments tend to live the longest. So that's just a factor to consider when we're factoring in, new medications and new treatments way downstream, and we're not addressing the initial cause. So I want to put that out there. Also, nutrition education is a big challenge in schools. And in general, a lot of people actually have a comment prompt here. Leave a comment if you know how many servings of fruits and vegetables per day you're recommended to eat, because a lot of people don't know anything about nutrition. A lot of healthcare professionals don't know anything. They take like a half semester class. Fortunately, I have, my degree in it, and I studied a lot because I find it really interesting, the biochemistry and how your micronutrients interact. But a lot of people just don't know these guidelines. So leave a comment, leave a guess. We'll go over it later. No shame if you don't know it. I'm just saying we're having problems beyond just, medications that we might not be considering, right? So the next one, it doesn't account for nourishment and health habits, right? So if you have a smaller appetite, but you're still eating junk food, then you have less space to get some of the nutrients that are going to be in those fruits and vegetables, some of the fiber, and all your balancing, macronutrients and all that stuff. I don't want to get too technical in this, but there's that. And also your health habits. Obesity is a multifactorial kind of thing. It's not just about, extra fat. It's about the lifestyle behind it, making the choices that support it. So this new medication for weight loss doesn't really account for that. Next, semaglutide has a minimal effect on shape and muscle tone. So a lot of times when people want to get in shape, they want to have that fit look. It's not just about having that covering it. It's also about the muscle tone that's underneath that, supporting it, giving you shape that you want. Also, we'll just leave it at that, right? So, or mobility. Mobility is a big thing too. We'll get into that a little bit too. Make sure you move right. You feel comfortable. You don't have any of that back pain. So if you just have less fat, you're still not necessarily moving well. So you want to make sure that the exercise and the activity is incorporated into your weight loss plan, right? Next, this is a big one. A lot of times when people say they want to lose weight, it's not about the weight, right? It's not about having extra fat. A lot of it is related to confidence and having a sense of belonging, knowing that you can overcome obstacles, that you can make changes to impact your life physically, like your physical being, and then your people and community around you. And so if you're relying on a medication or some kind of supplement to do that, and you haven't put on the work to make that happen, then you won't feel like you've earned it. And you don't have necessarily the same amount of confidence and swagger that you're looking for, right? You'll just be like, all right, now I'm just less fat, right? And so that does have its benefits. Obviously, we were talking about the health risks and stuff, but sometimes that confidence that comes with actually making the changes is really what you're after. All right. And then another thing I noticed, the modest results. So I would test this with a more thorough and accountable lifestyle protocol, right? So the 0.5 pound per week over 68 weeks is over a year. To me, that's really slow. I just had a couple clients finish. They lost 23 pounds, 11 pounds on very moderate. It was not extreme weight loss program. And we did that in 14 weeks. So that's a fifth of the time. So I wouldn't say multiply that by 5, but if you get what I'm saying, if you have more follow-up and accountability, they're only following up with these people for diet counseling every 4 weeks, right? If you have more accountability to make sure that you're on, I do weekly check-ins, then that's going to help you have that sustainable lifestyle change beyond just, as long as you are taking the medication. So leave a comment or like if this is resonating with you. If you're hearing me, you can share this video as well. Would appreciate that. Here's another thing that is a potential drawback. Semaglutide is not ready yet. They're still in these studies, right? It's 2021. They're still working on it. The cost, it's not covered. Obesity treatments are currently not covered by insurance. So you're going to pay out of pocket for that. Side effects that I mentioned. So back to that, 74% of the people in the study in that trial group taking a semaglutide had at least one of those symptoms, 74%. And that's compared to 48% of people who were not taking it. So it's going to have a risk of side effects. A lot of times those side effects will decrease. However, I'm just saying that, it's something to consider overall. And then also looking at ways to work upstream with the causes, right? So not just the end, right? So you already have the extra fat there. Looking at ways you can switch your lifestyle, change your food environment, change food policy, change the culture of health that we have around us. All those things are going to be other options in our weight loss toolkit, so to say. All right. And so what I'm going to do now is talk about, like, if you don't want to wait for this miracle drug or any miracle drug and you have health risks now, right? You remember those health risks. You don't want those things. And you want to reverse those and find a way to start getting those 5+ servings of fruits and vegetables every day. Did you get that? Then I do the guilt-free game plan's 14-week coaching process, but I have a free guide that's linked in the description below, about 4 minutes to start losing weight. Basically, I'm all about sustainable lifestyle coaching to help you reach your weight loss and business goals. So that's what I do. Check out that download. And let me see what kind of comments I got. 5. All right. We got some people got there. Yeah, there's a lot of people with the side effects. And then congratulations if you got that right with the 5 servings of produce. Very proud of you. A lot of people missing out on that. Some of these people in my Facebook group, the Scale Smashers. So you want to check that out too. We're getting lots of health education there as well. And that is it. Some things to consider when it comes to these weight loss drugs. Anytime you're talking about a supplement or some kind of smoothie program, or even in the case of like a new use for another pharmaceutical, all of these things come into consideration. We're talking about weight loss and how we think about food and our health. So that's it. I'm Reggie. Like, comment, subscribe. Thanks for watching, and keep practicing. Bye.